dinner. And this Wednesday is Genevieve's dinner, and she likes sushi. So I just went to get some sushi and bringing it out to the country where she lives.
Oh boy, that sounds fun. So I guess Kurt, are you with us? I mean, he's connected. I don't know if he's gonna come on or not. But I guess going along with the community impact topic, I guess what kind of impact do you want to have on the community, or what's your thought of community impact? I don't know if that's the right worded question, but if you want to talk about community.
Yeah, no threat. Yeah. Community impact is a really, really important thing, you know. Depending on, it depends on the sense of community, you know. I mean, you can have a community of, professionals. You could have a community of like-minded individuals for whatever niche that it is, you know. But having an impact on that is really important. So what my thought of that would be is being available and being able to help somebody with just literally anything, or even just being like a text message away kind of thing. So that way, if anybody has any questions about literally anything, they're more than welcome to reach out to you, because I mean that's what a community is in general, is like-minded individuals sharing the same cause to go out and complete a task that's relatively similar to an extent. I mean, there can also be like bajillions of other things, you know what I mean? But
excuse me, Nick.
Being there is a big thing. Yeah, what's up?
Yeah, now we can hear you. Yeah, she wasn't able to hear me before, so.
Okay. So y'all hear me? You hear me, Nick?
Yep.
Absolutely, Jennifer. It's been like legit forever. It's so good to
Whatever.
see you.
I texted you yesterday, or was it like a couple days ago? It was this week.
A few days ago. I mean, but it's like it's cool to see your face. You look great. It's awesome, man.
But I got to thinking about our conversation. You're right that we did talk by phone about insurance, but what I was talking about, that's what disappointed me with the Zoom meetings. But we did talk by phone. You're right. So
yeah, it's okay. No stress, man. It's okay.
I just underwent surgery, so I'm on week 2 of a 6-week period of being out of work. I just had to be on here.
Yeah, we missed.
I gotta show some love to Emily and Kurt, man. You guys are fantastic.
Yeah, we missed you.
Well, I love being on here. I don't care what my doctor says. So.
Yeah, we missed you a couple weeks ago, Jennifer.
I look. What'd you say?
We missed you a couple weeks ago when you were going to be on.
Oh
right?
yeah, 3 weeks ago. Yes, yeah. Thank you. I'm sorry I couldn't make it. You know how I texted you and Kurt about some things that happened that just put me in a mindset that I couldn't work.
Yeah, it took a little bit of I didn't get messages right away, whatever. But
yeah, that was so funny. I was like, "What do you mean?" Because you were calling me, and it was how it's really that I accidentally used my new phone number, not communicating that was me.
Yeah, I was like, "This isn't Jennifer. Who's this?" Like, this isn't Jennifer's number that I have. So.
So many Jeffers in the world, especially in my generation. I was like the most popular female name in my generation. So I heard what you were talking about, Nick. What was our topic that was your feedback for? Like, what did Emily ask or whatever?
Well, this is a kind of a new podcast. I was just asking Nick about community impact and like what kind of impact he wants to have in the community and kind of his thought on community impact have in general.
Okay.
So if you have any,
we're losing Nick.
So if you have any, yeah.
So community. Oh, okay. While we're waiting for Nick, I was.
There you go.
Are you there again, Nick?
Hey, can you guys hear me? Okay.
Yes.
We lost your video for a second.
So I'm driving like way out in the country, which is fun. So it's actually kind of interesting to see, like on a streaming service, like how far the cell phone towers are spaced away from each other. Because when I'm in between, this is the break stuff. So much fun. Good times.
So I was gonna basically pick up on where y'all started, because really I'm supposed to be co-hosting, but I had my technical issues. So you were saying about it's a matter of impacting the community, Nick. What is your avenue that is your point or focus, if you have multiple ways of doing that you'd like listeners to hear?
What was the last couple words?
What is
After point of focus?
the point of focus or methods that you want the community or listeners to hear that is your way of, like you said, having an impact on the community?
I'm so sorry. After point of focus, it keeps breaking up. My humble apologies. I truly apologize.
So I was saying,
here we
after,
go.
so you were talking about having an impact on the community. I guess we're losing him. Testing, Nick.
Nick, are we losing you? I think we might be losing.
Okay,
since
so
he's
how
come out
about
of the country.
I'll start feeding on this. So, listeners, we were basically talking about Nick Davis's point about we need to have a good impact on our local communities or community in general, and ideas of the way we can do that are various areas related to basically becoming some kind of worker and entering the workforce in some method. And based on your method, like what kind of work you do, like Nick as a insurance broker can have an impact on the community through helping people get various insurances they need to have, like in my case, I spoke with Nick at one point about health insurance. So his avenue of helping the community is, at least in one way, helping people have health coverage to get the health care they need for their best blossoming and productivity level based on being healthy in various areas. So that's where we were going. But are you back with us, Nick?
I think so. Can you guys hear me okay?
Yes. So did you hear did you hear part of what I was just saying about basically explaining that you're in the insurance industry? So one impact we could get through your involvement is to get insurance to help, like, let's say for the example, I explained that I called you about health plans. It could be by helping improve the health of the community. So what do you have to add to that? Like, are there other types of insurance you work with? Or do you have creative ideas that are outside your profession? That's the way we could help the community.
Absolutely, and thank you so much for that. It was really, really sweet. So, yeah, health insurance is really, really important. So the benefit to being where I'm at right now, because I'm at like one level above where a broker is, if that makes sense, right? So
right.
The cool part about that is I can find loopholes, and like I know where all the loopholes are for all the policies. And so if there's something that's not being covered correctly, or something that could be done better, I'll find a way to do it, which is really, really cool, right? So that's one way I can help. But the other way I can help is, I put out videos like every Thursday, and my videos are, a lot of the times they're about health insurance, but sometimes they're about some other things too, like, for example, like how to make a video, or how to present yourself, or how to network, or, hey, if you are on a networking call, or in a situation where you have to introduce yourself to a bunch of people, how are you going to do that?
Would I be right? Would I be right to say that generally your channel's purpose is helping with professional development because of the idea of networking, because they may not be a business owner, but they may need that, or health insurance they may need even without being a business owner to get it independently. So your overall, I hear, is your YouTube is about helping with professional development and or growth.
That is fantastic. Man, you're so sharp. That is amazing. Thank you very much. That's wonderful.
So what is the name of your channel? I'm going to put it in the chat and announce it.
Oh, for sure. Okay, so my YouTube channel is not very well set up. There's like 2 videos on there, and they're terrible. I have like 70 videos. I haven't uploaded them yet. So probably the best way to find any one of my videos is you can type in the hashtag reclaim your premium, to almost any social media profile, and I'll be there. You should be able to find me easily that way.
So I'm going to put here, find on social media of choice at hashtag what?
Reclaim your premium. One word. And then also
Okay.
something kind of cool that I noticed a couple days ago. So you know, like sometimes like you Google yourself just to like kind of see where you're at or whatever, you know.
Right.
I was so incredibly excited about this. Like as a small business owner, this is like a big deal. I was well anyway for me anyway. But
Yeah, I know.
Googled-
I get small business. But go
okay,
ahead.
cool. Yeah, okay, so this is awesome. So like I Googled reclaim your premium. I'm the entire bloody first page of Google. Like the whole first page is me, with the exception of like the last link. That is like the coolest thing ever. So I was really excited about that.
Yeah, that's one way. That's one way.
Does
Nick.
that feel like you marked fame? Does that feel like you marked fame, Nick?
That's one.
It was fun. I was like, what?
It's one way Nick is making an impact.
Well,
It's been taking up the whole first page of Google. A Google search.
And you know what do you know what we call that, Nick?
What is that?
Search engine optimization.
Well, of course, but I did it organically. I didn't like pay for it at all. It just happened.
That's still what it is. It's an organic SEO, but it's still SEO. You just were able to do it for yourself and maybe even surprised yourself that you were able to do it independently without professionals.
Yeah, I was like, well, hot dog, look at that business. That's great, man.
Now the idea is you need to get it where it shows other things like health insurance or auto insurance or other things to show you as the result.
There you go. That's fantastic. That's a really, really good idea. I'm gonna try working on that.
Well, if you want more of these things, you can call me for business consulting or advising.
Hey, well, there you go. There you go. And she's like, yeah, I am just gonna
Hey, it's about nature. You know, a lot of us that are passionate about what we do, we do it without really being paid and without really being told to do it. It's our nature,
Yeah.
you know what I'm saying?
100%, 100%.
And that's obviously shows that part of my passion is my business advising and consulting. And when you run into similar with whichever insurance choice you want to be as your topic, you're portraying the same thing. And those are the best professionals to reach out to or to hire based on your avenue of seeking product or service, are those that are passionate because they do better jobs and they care more about the client/customer. They're more appreciative. And so you're showing that characteristic. And you just said, I am too, but the fact is that's why we are great at what we do.
Mm-hmm. That's a good point. That's a very good point.
So on your topic, a different topic, because like I'm interviewing you. So what's another, let's say advice or community impact or other method you'd like listeners to hear about?
I don't know. Literally, I mean, so many different things, man. So like, I would say, let's see here.
Maybe if you need
What?
some ideas, what about things related to the Affordable Care Act? Any changes that could help with
Yeah.
seekers, you know, or employers or other people who may be seeking it at different levels of authority?
Yeah, that's a good point.
And maybe even if not necessarily healthcare, does that have do your listen? You know, what if your listeners aren't sure if that has anything to do with also auto insurance or anything else besides health and healthcare? Like,
For
you know,
sure.
these different things. What are some ideas or updates?
Yeah. So I would definitely say, so my focus is health, dental, vision, and benefits, basically, right? And so
Okay.
in that space, some good things to look for, right? So if let's do price, right? So say for example, you're like, man, am I paying too much for my health insurance? I don't know. Usually, if you're questioning if you're paying too much for your health insurance, usually you are. But there's a cool little math formula I came up with that is pretty it's pretty darn close to like relatively accurate, just for like spitballing numbers, if that makes sense, right?
Right.
So if you take your age and add and give yourself, or add a 0 to it, and then give yourself a tolerance of about $75, that's what your policy should cost, right?